At the forthcoming festival right here in Dubai, details of which are on our Facebook page right now. Equally, get your hands on his book, Greens, Cuisine and More. When we come back from a short break, we're going to be talking to cardiologist Dr. Talib Majwal, who educates us about the latest groundbreaking treatment on heart disease.
And stay with us because in a heartbeat, one of you could be tonight's winner, so don't move a muscle.
Evening all, welcome back to Studio One. Now, our next guest is here to talk about a groundbreaking heart surgery, and one that's being hailed as the fourth revolution, no less, in heart treatment.
Absorb is the name of the treatment, and Dr. Talib Majwal, consultant and director of interventional cardiology at Dubai Heart Centre and Dubai Hospital, is here with us to tell us more. Doctor, welcome to the show. Thank you so much for joining us.
Thank you very much.
Now, Absorb, this new groundbreaking technology to treat coronary artery diseases. Before we get into any of that, I'd like to know a little about cardiovascular disease. It's one of the leading causes for deaths, especially in this region, and it's said that almost 1 in every 5 deaths is attributable to this cause. Why is it at its peak?
You know, it is globally, it is maybe the second killers after cancer, because of it is a very common, there is a lot of reasons for that. But if you go to our region or this part of the world, we have completely different from Western type of patients. Our patients' population is at least 10-15 years younger than the patients in the Western side of the world. And this could be attributed to many, many reasons. For that reason, we are always looking for the new technologies to be applied on those young patients to prevent death or prolong their lives and improve the lifestyles of the patients.
Now, I think we have to reiterate the fact that you performed this surgery 2 weeks back in the Dubai hospital, and it's the first in the region. So, I mean, this is really putting the Dubai Health Authority...
First in the region and the 5th worldwide.
The 5th worldwide. So this is putting Dubai Health Authority and Dubai on the map, isn't it, in terms of...
It is on the global map, yes.
And talk us through the actual procedure itself, because a lot of people will understand certain cardiovascular surgeries. What's so different about Absorb?
Absorb, we use what's called the fourth revolutions. It is the amazing technology, because what we used previously and even these days, when you open an artery, we put a support for the artery to keep it from the region coming back.
Like a stent or something like that, isn't it?
It's called stent in the medical terms, yes. And we used to put a metal stent.
Right.
And once we put it, it will remain for life.
Right.
So we cannot remove it, we cannot move it, we cannot change it. So this is a new technology which is very amazing for the last decades. There are a lot of work on that technologies that we need the support in the blockage only for the first 3 months. We don't need for the whole life. So we came to a new technology that will be support the blockage or the artery for 3 months. And after that, the body and the blood start to digest these materials. And within 2 years, if we do any angioscopes or camera from inside the arteries or do anything, we don't see anything. So because the body has been digest this to very simple ingredients. It's just a water and gas, which with no any harmful residues remain in the heart. Yeah. This is a very amazing and very promising. And we are looking forward, especially because I said our patients are young. So if we do now, 2 years from this times, there will be nothing in the side of the heart. So if the patient needs another procedures after 10 years, 15 years, whatever, then we can do it again because there's nothing. Even if you need after many years, if you need a bypass surgery, there's nothing in front of the surgery to prevent the surgeon from implanting a graft. So really, it is a very tremendous technology.
Quite right.
Now, doctor, what types of heart diseases or at what stage does a patient require the Absorb treatment?
I think the younger the patient will be more benefit from that because of the expected life expectancies. We don't think it will be a good choice if we put a patient 70 years or 80 years of age because the life expectancy is different from a patient with those 40s or early 30s. We have, if you're coming to our hospital, we have heart attack patients in mid-30s. And our average is 45. Average age in the Western countries between 55 and 50. So we're looking for this technology because for that reason, this is one of the reasons why they have choose Dubai. And we have choose the Middle East because of the type of populations of patients we have. So the younger the patient, the more the benefit will be.
What are the reasons? Why is cardiovascular disease so prevalent in this region?
I can tell you there's thousands of reasons, but in this type, especially in Dubai, it's because of multinationalities. We know maybe hundreds of causes why they will get this disease, but maybe still 1,000 other causes is not yet none. But we know because of the type of the foods, we are just talking a few minutes about the healthy food. This is very important. The type of lifestyles, lack of exercise, truncal obesity, hereditary factors, genetic factors, there is a lot of factor involved in that.
Now, I know that this form of procedure is fairly new, but is there any side effects to it?
Technically, it is not a new. We have done this maybe 30 years back. So, but the material we use, it is the new one. It doesn't differ from any other procedure we perform. Maybe some tick and trips, how to put the scaffold, how to take care of the scaffold, how not to damage the scaffold during the movement inside the body. And we are involved in this project maybe for the last 2 years. We shared on a lot of confidential meetings because this is a new technology, so everybody wants to keep it a secret as much as they can. So I think for the time being, it is a very simple procedures. It is a very safe. Our patients went home on the same day. It takes 20, 30 minutes maximum.
Amazing achievement. Congratulations to you, Dr. Talib, personally, and
much.
all your team at the Dubai Hospital for performing this particular surgery. A first in the region, a first of its kind here, and the first of many to come. Thank you for being with us.
Just one thing, it is not only for Dubai Hospital,
For the whole
Dubai
region.
Health Authorities at all, because we are 2 hospitals involved.
The Dubai Hospital, Rashid Hospital,
And Rashid Hospital,
and of course
yes.
the authority. Yes,
Yes.
you're right. Thank you. It gives me pleasure to welcome you to enjoy a little bit of food because I know it's healthy this
Healthy
evening.
one.
So do stick around
Thank
to
you
try
very
that
much.
one. But
Thank
thanks
you
so much
very
for being with us.
Thank you very much.
Right, listen, actually we were talking about slang a little earlier on,
Yeah.
weren't we?